Thank you, Mr. Chairman. Commander, I come from South Dakota. It's 200 miles north and south, 400 miles east and west. I think we've got a number of members of our delegation. Would the members of the South Dakota delegation please stand and be recognized? Where are you at? Way in the back. Thank you. Appreciate it. Thank you. Commander, rural areas, we struggle with getting healthcare professionals appropriately distributed throughout the entire state. We've got veterans in a lot of our rural areas as well. A number of our Native American reservations are very rural. So simply getting someplace where you can find appropriate health care to begin with is a challenge to begin with. And I noticed in your opening statements, you indicated that you really were concerned that we not privatize the VA. And yet, I don't think by suggesting that we not privatize the VA that you were indicating an unwillingness to have non-VA services being provided. And I'm going to give an example. I've got a veteran who's 83 years old, lives in Pierre, South Dakota, the capital. It's 170 miles to one of the facilities that he would be going to. He wanted to get a set of eyeglasses. He broke his glasses. Went to his local optometrist in Pierre, got it done, got the prescription, turned it into the VA. All he wanted to do was to get glasses. They indicated, sorry, the optometrist is not a VA optometrist. He'll have to come 170 miles out here, have the VA check his eyes out, and then we can get him a set of glasses. I don't want an 83-year-old veteran that broke his glasses on the road, quite frankly. And neither did he. But it took us 6 months to get it resolved. And what in fact, my chief actually offered to drive to Sturgis to pick up the glasses, and they didn't want to do that either. What I'm suggesting is just to be very clear and so that everybody understands, I don't think the VFW is suggesting that using local facilities, and particularly in rural areas, is the same as privatizing the VA. Could you comment on that a little bit? I think our thought process, and there's a lot closer than it might appear.
Well, staffing issues are concerned, and accessibility for care is concerned. And we're certainly not completely against that. In fact, Mr. Wallace has just written a position paper about that. Mr. Wallace?
Senator, there are a number of people to say we should just privatize the VA and give vouchers out to veterans and let them go where they want to go. That's not quality care, because you got to manage what the hell's going on with somebody's life, especially of the specialties that the VA provides. But we realize that VA can't provide everything, and they should give it to the veteran when the doctor, the clinician and the veteran determine they need the care and the closest available place to get the care. We have no problem with that. The VA must be the guarantor of that care, and the VA must get those documents back because it could affect the veteran's service-connected disability, or the veteran could be entitled to a disability. But we're not saying that we should not use VA. We should leverage what VA has and what the community has and get to both the best worlds for the veteran so that they get the health care they need in a timely manner.
What I hear is we ought to be focusing on the veteran, and that's where it ought to go.
And you have unique challenges in
Yes.
your area, as you mentioned, with the mileage. I mean, it makes no sense to send somebody 200 miles because it says VA on a structure when you can send them down the street and the VA has a contract with them, guarantees it, and they get quality care because the VA is the guarantor in managing it.
That's right. While at the same time allowing for areas of excellence when it comes to those service-related injuries that we really do need special expertise to be provided specifically by the VA, by providers who understand and see on a regular basis some of those challenging service-related injuries and illnesses. Let me just touch one item just in the minute I've got left. In your testimony, Commander, you recommended Congress support VA's budget request for $421 million to establish and implement various IT programs and initiatives to improve veteran access and community care. While smartphone, laptop, and internet technology improvements all have their purpose, time and time again I hear from older veterans who want to talk to a live person, a real person, and want to know their appointments have been made or their issue has been heard and fixed. What do you hear from your older, non-tech savvy generation of veterans regarding these new proposals?
Well, scheduling for VA care is always the issue. And certainly we want them to have timely and adequate care. And the ability to talk to someone for older veterans is part and parcel to what the VA needs to address. And also the fact that they do follow-ups for their appointments to check and see how well they did. And scheduling those appointments and follow-ups are very, very important to the coordination of case care.
Thank you, Commander. Mr. Chairman, thank you.